Thank you. While everyone's getting seated, I'll go ahead and formally introduce our next speaker, who you've met already, Dr. Bleyer. Dr. Bleyer is a clinical research professor in radiation medicine at the Knight Cancer Institute at the Oregon Health and Science University, professor of pediatrics at McGovern Medical School of the University of Texas, and a collaborator of the Institute of Health Metrics and Evaluation at the University of Washington. One of his peer-reviewed publications on public health, of which he is particularly proud, is titled Increased Rate of Unintentional Firearm Deaths in Youngest Americans, Firearm Prevalence and COVID-19 Pandemic Implications, which was published in the Journal of the National Medical Association in 2021. He has devoted 5 decades to clinical research, during which he has been the recipient of more than $85 million in grants as a principal investigator and an author of more than 300 original reports in a bona fide peer-reviewed medical journals. Recently, he has focused his research on firearm violence, cannabis opioid life expectancy, and overdiagnosis issues in the United States. And for personal benefit, care of his dog, Teddy, swimming, walking, and golf. And with that, Dr. Bleyer. And you can either use
Yeah. Teddy's also the person who's helping Anne fly back and forth in all various places, so Teddy's very important. Oh, can't hear me. Okay, testing. Chester, thank you. Okay, thank you for the introduction again, Yama. You can see what's on the screen, but more importantly, there are 4 of us who worked on the research together, and we've published 3 articles, one just a couple of weeks ago. The first one was in 2021 on the increasing rate of unintentional or accidental firearm deaths in youngest Americans, and I'll show you the data. By young, I mean the youngest. Second was pediatric benefit in retrospect of the federal assault weapons ban and why it was allowed to terminate and expire by statute the way it was originally set up is hard to imagine in retrospect. And there's an obvious way we can improve on that as a rationale in a more effective ban. And then the most recent was, and we can talk about this, Ricardo, if we have a little more time, because I did take the vote this morning, the issue of mental health and whether we can blame the problem on the United States mental health challenge. I'll try to remember to come back to that. Put your hand up if we don't. Well, it's okay. So the 4 of us are musketeers, if you want, co-conspirators, but none of us have any conflicts of interest, either financial or in any commercial way, to be part of this effort. And that disclaimer always has to be provided to every speaker, by every speaker, and researcher, epidemiologists, etc., involving this program. I will stop for questions and comments at 3 or 4 points during the program after each subject material. And you'll see this purple or bluish outline, and at the top, questions, comments, for you to ask questions, and we should have that one and only effective microphone working available. We got more than one now, or is it still one? We got 2, okay. So I'll allow you to comment, question. So I'm going to take the Surgeon General's, the United States Surgeon General's report, advisory, and work through the 3 most chosen votes this morning. And we'll start with require safe, secure firearm storage, including child access prevention laws. So now we go back to our report in the Journal of the National Medical Association in 2021 to deal with the youngest Americans. Back then, we had data up to 2019, released as final data by the Centers for Disease Control and Prevention. And I looked at by year of age with my colleagues, starting at birth through 1 year of age, and then up to age 10, from left to right, in terms of the unintentional, interesting, J intentional if you look closely, unintentional accidental firearm deaths in this age group in the United States. And what you can see with the dotted line at the bottom back 2 decades, that line, that curve, has gone up with each follow-up interval. So that in 2014 to 2018, we had an increase, especially in 2 to 5-year-olds, dying of bullets, mainly in homes. And these are almost home occurrences. Now, if we go back and look over the same interval of years, in terms of that progression from the lowest to the highest, the peak that you saw, going on in the United States was the purchase of firearms, and these are the total firearm background checks, which underestimate the firearms because many bought more than one. Many bought many firearms. So if you had 40 million background checks in 2020, and their averaging is 2 guns per purchase, you can imagine how many firearms were purchased in just the first year of the pandemic, 2020. And yeah, that's one of the reasons why that arrow is pointing up, because it skyrocketed from 2019 to 2020. So if you keep that curve in mind, it's exponential. It's not just linear. It's just not going up straight. It's going up exponentially, going up faster and faster with each year, up until 2020 at least. We predicted, based on that pattern, that because of the increase during the pandemic, at least this first year, more of our children would die than ever in history in the United States during the pandemic when all those firearms were purchased. And that would especially affect the 2 to 5-year-olds because we saw that peak between 2 and 5. So now I'm going to update the data for the last year of data available, 2022. The red line is the update. We underpredicted what would happen. Not only is that peak much higher than the projected trend, should have been half as high as it was increased, half the increase based on the prior trend, but also it now includes 1 and 6 and 5-year-olds. It's a wider range. And we can talk about how a 1-year-old can be killed at home with a firearm. The 2 years old, we know, can have the strength to pull the trigger, so they can shoot themselves. The 1-year-olds probably were hit by somebody else in the room, a sibling, a friend, a relative, but died nonetheless. The United States of America. Okay, now the issue of safe, secure storage laws. This was published by Everytown, not an accident, as of the latest date available, 2022, again, having to deal with that. And the darker the blue, or the more blue the blue, the more rigorous the state's legislation, statutes in terms of protecting the use of the firearm, the access to the firearm by storing it safely. And it's at the bottom in terms of no storage laws, whatever, in that state, the lightest color, to the bluest, blue at the top, which is the most rigorous and requires secure storage all the time, whether or not there's children present. And when the owner, him or herself, and by the way, herself is more increasing too, him or herself is in the room or in the home or nearby in the residence, apartment building, whatever. So it's ordered in that way, from the bottom color being the least to the highest. And you can see where Texas is. It's in between. It's right in the middle quintile, if you will, in the middle of that range. So we then looked at each of states' law level, rigor, and the rate of firearm deaths. Now we picked the age up to 9, so less than 10 years old, because that's where the accidents occur, the unintentional firearm accidental violent deaths. Okay, if we go to the bottom where the least rigor is applied, the state has none or minimal, you can see the in terms of the width of that bar, the death rate in 0 to 9-year-olds, birth to 9-year-olds in the United States. And there were 27 states that were in this category, and you can see that their range is similar. That horizontal black line, kind of like a mustache, whiskers, is the 95% certainty that that data is accurate. 95% sure there's the real answer somewhere between the ends of that whisker or line. Now, if we go up one category to the law, if a child does access an unsecured gun and something bad happened, death or violence or injury, that the state would then hold the owner responsible. That's where Texas is. And notice that the improvement in the death rate is statistically significant. Texas is among the 15 states that have that kind of law. So you're doing better than the others, the other 27. But what about even more rigorous? I mean, is there evidence that it's worth doing the safe and secure, safe kids worldwide, etc.? Well, if you look at the best, or if you will, take my adjective, best, most rigorous level of protection, it's again more statistically significant better. And I put Oregon because that's where I've lived since leaving Texas. And at least I'm proud of that one fact. A 12-year-old teammate and classmate of my grandson, when they were living in our town in Oregon, killed himself after leaving a message from his parents' active gun, and they are both in the health profession. I knew one of them. That's one of the reasons I'm standing here. 12. Suicide is a problem in that age range, and we will come back to it too. But here's safety in terms of accidental deaths. Okay, so the more rigorous the rule, the law, statute, regulation, the fewer children as young as 1 and 2 years old die in this country. These are the data, unpublished, that should be used in every state, if not federally, now that the White House has issued just a couple days ago their latest effort to ensure safety. Yeah, I'll have to present it to them sometime soon. Okay, so Rice University, who had the 21-year-old die on the first day of school a month ago yesterday, also has held annual, 2 or 3 years now, of firearm prevention and violence issues, all day long conferences. I was attending one that was held in Houston, and what I forgot or didn't realize is one of their recommendations was the Consumer Product Safety Act should be modified to include firearms. That happened here in Texas by Rice University, or at, not by. All right, thank you. Thank you, Rice. Thank you, Rice. When I walked from West University Place, where we lived in Houston, through Rice University, or rode my bike every day to get to work, I can tell you it's hard to imagine the university with their aesthetic having that happen. It's just hard to imagine. And I did that for 14, 15 years. Thank you, Rice, again. Okay, so the summary of this section is that the product safety rules should include firearms and render the industry liable. That every state and the first district, where Mike and Marion Newman live nearby, and Ann spends time, should have safe and secure storage laws, and that the childhood access prevention statutes, which render gun owners themselves liable, be passed in every state. Better yet, should be federal. The White House should ensure this is not just local and jurisdictions that can decide whether or not they want to save lives of their youngest or not. And yes, every fire owner should be able to have, if not access, have provided to them when they purchase or are issued firearms. Hard to do with 3D guns built at home. We can talk about that. And that every prospective gun purchaser has to go through storage as a training along with being issued or allowed to have that firearm. Questions, comments about something that's so obvious? Pat, I'll repeat your question. Go ahead.
So what are we gonna do about already?
What are we going to do about the NRA?
Opposing anything and everything?
What are we going to do about the NRA opposing everything and anything? 3 days after Uvalde, they had their annual convention in Houston. All right, you want to help answer? Thank you. No, we got another question?
I have another question. I don't want to answer
Okay.
that.
All right. Are you going to answer the question? Yes, go ahead.
So,
Stand up and speak of that way.
okay, so what I believe the answer is, and I haven't seen anybody try this, and it would be pushy to get it started. But the way the NRA does it is they have talking points, which they hammer and hammer and hammer and hammer. So, the NRA has talking points that they pound into people's minds. So what we need is, in my opinion, is a professionally generated presentation where we get PSAs on radio stations all over the place that talk about the real information and how many lives we could save, and that the NRA data is not factual. That's the way that I think would be most helpful.
Any other comments on that? Or comment or question?
You have another opportunity November 5th.
Oh, yes.
to
November 5,
To
potential.
actually change some policy. But I wanted to ask a question because your slide said unintentional. What do you think about the trend right now? They just had a conviction on the parents who bought their child a automatic weapon. They knew he had psychological problems. Is that, because what I'm hearing now, and they're all great suggestions and strategies to reduce gun violence and to cope with gun violence. However, it's changed us all. All of us are traumatized. And a perfect example was I was at a function last week and there was a balloon arch. The function was 20 minutes from being over and they were starting to clean up and somebody just went and did all the balloons. There was a room full of traumatized people. They were ducking. They were, who is it? Stop it, stop it. And my question to you, do you think penalizing and prosecuting the parents that actually enable somebody to commit a mass shooting is a step in the right direction?
There is so much that we could or can and should do about those events. It's going to be a lengthy answer, so I'm going to be inclined to defer, but I'll come back to it. I also want to allow the other, yes, you were going to ask, Mary.
So my question was just about the secure storage laws. So in Texas, it's a Class A and a Class T misdemeanor. And I'm wondering if you looked at the comparison between the secure storage laws that are felony.
No, I haven't, but I think that's doable. So let's do it afterwards and together. I do think that it's going to probably be a solid hypothesis in the affirmative that felonies are more likely to have an effect than a lower class of regulation or interference. I do believe that. Mike?
I come back to the issue. It's the guns. I'm not sure the NRA is going bankrupt. They're having problems with their own organization and so forth. But it's the availability of guns coming across the border, the way people get guns. That's what the issue is. And you can go online and order your, it's the guns.
It's the guns. It's always the guns. And going across the border, since you're not far from it, Mike, compared to where you came from, the problem is not coming in from Mexico. It's going across to them. That's 90% of their supply, and that's why they have one of the highest death rates among the other countries in the world. So we're responsible. We're killing Mexicans. We, our gun industry, are killing children in Mexico. You know, guns are not allowed in Mexico. If you walk or drive into the country, you see signs on the roadway that says firearms not permitted.
Where are guns manufactured?
Almost all of the world's guns are manufactured in, let me think, United States of America. Yes.
I wanted to go back to the question about the NRA because I do have some experience, is working, at tabling at an event and being, I don't want to say confronted, but having the opportunity to have a conversation with members of the NRA. And they were grandparents wearing embroidered NRA vests. I was quite shocked and not quite sure what to expect, but I think it's really important not to confuse like NRA leadership and the organization with individual NRA members. I think those are the conversations that are the most important to be able to have dialogue. And I know from that experience that, they were looking to question the data and the facts that I had. And by the end of a very lengthy conversation, we were able to agree that we both agreed on the importance of secure storage and being responsible gun owners and sharing that I was a gun owner myself. It's not one or the other, and that we can have things in common and work towards a common goal, even though, we hear talking points that may demonize the NRA. And I think that's very counterproductive.
I got to support that. The vast, or I should say the majority of NRA members prefer safe storage laws. They really do, and they've been polled to the extent you can rely on that. They want to help in that respect too. So we do have to have significant respect for their stance, but they're individuals. I have a close friend who's a physician, and he really described the problem well. When an intruder is expected at the door, or the back door, or somehow near your home, he and she want to have that gun fully available, loaded, and ready to fire through the door if necessary. Like I saw in Houston, River Oaks happened. The person was shot through the door, and he was knocking on the wrong home. And we all know where I'm talking about. One of the most exclusive, presumably safe places in Houston. And he was killed. He happened to be from another country. So no, we got to deal with the issue, even with gun owners. How do we get them to store when they think they need to have it sitting right next to them in the bedside table? That's been the biggest, I think, emotional issue. Does anyone have a comment on that? Okay. All right, Ann.
Yeah, I just wanted to say that the NRA is officially bankrupt now. I don't know how much help they can be either with their membership or anything else, because it has been well publicized that they are bankrupt, and they have stated that they are bankrupt.
I'm less worried about the organization per se, even though what I told you happened 3 days after 2.5 years ago, it's the Uvalde issue. I think there'll always be another an organization. It's the membership themselves. It's like those of us who complain about one of the. Yeah. Okay. Yes. Go ahead.
I'd just like to respond to this. My name is Stephen Sanders. I'm a United Methodist pastor, and so I represent Methodist Healthcare Ministries, but I volunteer with Texas Impact. And I think from my perspective, and one of the things Representative Goodwin has helped me understand is we need to have a long-term perspective on this. To counter the voices of the gun lobby, we need to recognize this is long-term work that they have engaged in over a long period of time, and we need to do that. One of the roles that I am working with is to mobilize faith communities, because we have millions of people throughout the state of Texas who can raise their voices. I'm a hunter and I'm a gun owner, and I have begun the process of going and speaking with legislators. If we can have a long-term perspective and build a coalition of healthcare professionals, educators, law enforcement officials, and mobilizing faith community, we have the numbers on our side, but we have to have a long-term consistent message and work like crazy and coordinate our efforts.
I have to stand out here to make the point that over 200 was it, organizations are trying to help with this problem of gun violence, and are not organized. Okay, not like the NRA. We need an NRA equivalent for those 200 organizations of us that are trying to do this together. A letter was sent to the president a year ago, with 7 days before his State of the Union address, from 110 of them, missing most of you in this room who represent your organizations, because your organizations were not part of that letter. We are not organized enough. We are still too disorganized. And yeah, I see a lot of red shirts here, but I think the red shirts and blouses, whatever I'm supposed to say about them, need to coordinate every town, Moms Demand Action, Gun Sense, et cetera, because you're fragmented. And until you get your act together and be an NRA or equivalent, we're going to have a slower process, and we're going to let these kids and some of our age die. Sorry. Is there?
Comment on that? That I think every town has a lot of funding, and they have been a savior in many ways, but they don't have the 70 years of experience and membership dues that the NRA has. I mean, we were NRA members for many years. My husband is he's 5th generation hunting family, Texas. So until eventually I started opening all the mail in our house, we were NRA members in our house and sending them money. And so that they have a nest egg that we have been unable to match without Michael Bloomberg. But we now have the White House Office of Gun Violence Prevention that is coordinating all of this on all of our behalf. And they, I see a future. I mean, time is on our side. We're going to win this.
Yeah, I didn't say every town when I mentioned the others, but the time is running out, I think. But I have to point out that both presidential candidates and vice presidential candidates are gun owners. We know that now because the vice president on one side of the party brought it up briefly for a moment, for 2 seconds actually, that she is a owner too. So you have to accept that. 45% of the people I live with in Bend, Oregon, own guns in their home, have guns in their home. And I see you and deal with them on a daily basis. We have to be appropriate about that. So, of course, how you be appropriate. All right, last question, then or comment.
Yeah, where's the microphone, I guess?
Here.
Oh, thank you. Okay. So with my organization. So I was just talking about this earlier. With my organization, I mean, I would love to, support and be a part of a lot of these other organizations. But the problem is that with the work that I do, because of the fact that they are politically tied to candidates and money is funded to candidates for certain parties, we get vetted. And I get vetted quite often. And so I don't take from either side. It's either going to be, I look at it as either an all or nothing. Either everybody gives to me or nobody gives to me. Because if I go one way or another, I'm going to be vetted when I go to do a bus ad. I'm going to be vetted when I go to do a billboard. I'm going to be vetted. I don't even know if I could even work with a lot of the law enforcement agencies that we do because of the fact that, so I have made a choice, I guess is the best way to say it, for my organization that we will remain very neutral in this conversation, and we will stay that way.
Can you say
So,
what organization?
Lock Arms for Life, Lisa
Okay.
Ross. So that is one of the things that I have to say when you talk about tying all of these organizations, even, medically, one of the things is that you have to remain very neutral in how you approach this. And approaching it, yes, from safe storage, safe handling, and all that, as long as you have a very neutral voice, and again, you're not politically tied to any side, then you become a reliable source. And they have, especially gun owners, will have a confidence in going ahead and sharing with you. That's my comment.
Well said. We need to work together, and as the conclusion of the Surgeon General's reported, it's we. It's all of us, no matter what our stance is. You know, I don't even have to go on with the rest of my presentation because I think that's an accomplishment by itself. But there's one more point quickly now. Sorry if we can do it then. Okay, there's a microphone coming to you.
Okay, so,
All right, Pat, let's have the other, go ahead, ask your question first.
okay, I'm first.
Yes, you're on.
I think that I'm glad to attend here. My name is John Nava. I'm a physician in San Antonio. I'm with the Bexar County Medical Society. Something that I think is good that we are all pretty much leaning toward the same page, but I'm a little concerned that through all this, no one has emphasized the importance of understanding where the other side is coming from. And so that in the process of getting to where, as opposed to one or the other side of the polarized situation, how are we going to work and how are we going to do it, knowing that we haven't had those 75 years of building up a fund? And so I think it requires so much, especially when people are passionate about these things. And that means that we might have to, at the door, leave our egos and leave our preconceived notions while we meet with the other side. And I'm a family practice physician.
Okay, you understand the broader sense of things. Thank you for that. I'd rather even just stop at this point, but I'll go on with one more point if I can. What you have said about firearms is true for almost every issue that separates us. Firearms is one of many. And if we could solve the problem through the firearm, which would be one of the biggest, we could solve problems that are on the polarization issue for many others. If we could do it for this, we could do it for many of others. Yes, it's very emotional. And this country's become more emotional than I can ever remember since I remember at the age of 2, I guess, in my last 79 or 80 years, including Vietnam, etc. We're just as emotional as we possibly can be. So I think we could solve some problems if we could do what you said. And I think a family practitioner knows that as well as anybody. I'm going to ask Pat for a question, then I got to try to figure out what to do with the remaining time.
Well, let me bring some outrage to this as a punctuation mark.
Could you hold the mic a little closer?
Yeah. So let me bring some outrage to this as a punctuation. I knew of, but didn't know personally, a Special Forces individual who ran a gun use course, training course, and he was training a 9-year-old girl to shoot an Uzi. And that's how he got killed. She reacted, the first time she shot the thing, she couldn't deal with the kickback. It went over and he got shot in the head by his own weapon that he was training her how to use. He was trying to teach her how to use a 9-year-old girl, an Uzi. Outrageous.
It may be because I'm next to your state representative, but when Vicki comes back to handle the last session, we're going to continue this discussion. And she's learning from all of you here how to deal with it in this building. I don't know how many bills, she mentioned 3, but there are others that she tried to get out of committee to help with this problem. I mean, the last thing I want to be is a representative or a senator under the circumstances. Thank you, Vicki. Good one. All right, yes, thank you. All right, so let me just, if you've got 3 minutes here, yeah, that's what we're supposedly have here. The assault weapons issue. Let's see if I can pick the best slide or two. Okay, this goes back to 1968, and it shows for the entire United States the rate of firearm deaths per 100,000, 1 to 19-year-olds, children and adolescents. And it shows you that something happened in 1993 that went straight down, and then slower pace after that. And then finally in 2013, it turned around. And by the way, these are high sophisticated analyses that detect trend turns, trend inflections, when something changes. So these solid line of the dots is as reliable as a mathematician can be, or a statistician. And if you want to look at the decrease from 1993 to 2000, it was 11% per year. Okay, in those 10 years, it went down 100%, 111%, 110%. Okay, so let's look at that in a minute. Oh yes, it's gone up 83% in the last 5-6 years, but it went down 50% during that period of time of just 6 or 7 years, as you see there. Now here's Texas in red. You had a higher rate to begin with, and it went up about the same rate, but then when 1994-93 hit, you had exactly, if not more impressive, a reduction in the firearm death rate in children and adolescents. 15% per year. 15% per year. Striking reduction. And then if you look at the last part of the slide on the right, you see a faster rate in Texas than the United States. Now that explains something I mentioned this morning. Okay, at about 10% per year. Okay, so it went up 161% in the last 7-8 years, as opposed to 55% decrease back then. So what was going on back then? Well, in green is the assault weapon ban of the United States that was allowed to expire because of the way it was set in action in the first place in 2004. So the green is 1999 to 2004. Let's look at it a little more closely if we got time. Yes, federal assault weapons ban is associated strongly. In fact, to see something go up so rapidly and on the very first year of something new, different, turn around, completely reverse, and start going down as fast as we're going up, that's about as good as you can get as a causal relationship. Although we've looked at many other possibilities and haven't come up with any. So we reported that. Now this is age 14 and less. It's all firearm deaths in the United States. And there's that sudden reversal under the age of 15 and continued throughout the federal assault weapons ban of 10 years. And then it went up recently. If we look at suicides, now this is suicides under the age of 15. I told you about the 12-year-old I know. I know of 8 and 9-year-olds who suicided too, because they could. There was something available to them. Trying to drive off a bridge or jump off a bridge, it doesn't work too well in an 8 or 9-year-old, but they can shoot themselves. But notice that there's an even strong relationship with the federal assault weapon ban and suicides in children under the age of 15. And then how fast it went up after the ban expired. I'll just do this, well, that's just to emphasize that. We looked at every other cause of death that was an accident or violent death, non-disease related, non-firearm injuries, and all these that are 10 or 11 on the page here, 12 maybe, show no relationship to that green background when the federal assault weapon ban. So we're trying to show you that that ban specifically affected firearm deaths, not non-firearm deaths. None of them, whether they were car accidents, suicide, suffocation, fire burns, etc. That itself says it's got to be the ban. And we did more of that. I'll just go ahead and move ahead, but I guess I have to go fast. We looked at all the regions of the country. We've even looked at every state, and I can show you that too. And the correlation is there. Every state shows this. I showed you Texas. We looked at age. Yes, it's more prominent in 20 to 44-year-olds than in 0 to 19 at the bottom. but it's even prominent in the older Americans, 45. It's there. We looked at, and I'll just jump ahead, we looked at females and males. By the way, the females and male red curves here are Texas. I didn't show that to you. Yeah, there's Texas. I don't have time to illustrate this. And then finally, I think we'll go with this. These are the states, and it's their age-adjusted firearm death rate, all ages, during those 10 years of the ban. Okay, going back to 1994 to 2004, when the ban was effective in the United States, federally. Every one of those numbers is negative. Not a single state didn't benefit from the ban. But if you look at Texas, you see a 4.4% per year average over those 10 years, average decrease in their all-age, age-adjusted death rate from firearms. Yes, down below you see Hawaii, who had the best benefit. And then up right, New York, minus 6.6% per year. These are annual rates in California. But Texas was fourth. You had a striking benefit, fourth of 50, plus District of Columbia, 51 other jurisdictions. You should be advertising what you did during those years, or benefited from that. Okay, I'm going to skip the rest of this right now. Oh no. These are new data too. All right, the American Academy of Pediatrics, and the references at the bottom here, evaluated every state in terms of their laws regarding banning assault weapons. There are 10 of them. Interesting that the ones that I just showed you that benefited from it, well, even before they enacted the laws, after the federal one died, expired, are shown here: Hawaii, California, and New York, but not Texas. Okay, so there are 10 of them who enacted these laws long enough ago to be able to evaluate what's happened in their state. Okay, and they all did it in the last 20, 25 years after the ban elapsed in 2004. Illinois was the latest to do it. Oh, let's see if I can skip that. Okay. Looking at the left for both males and females, the pink are the states that didn't enact the bans. The green are the 10 who did. And this is the firearm death rate in the two groups. And on the left for both males and females, you see a statistically significant decrease in the states that enacted the ban after, this is as of 2022, after the ban had been in place there long enough to have an effect. And if you look at males and females, both of them show statistically significant, well, maybe not for the females, improvement. Yeah, no, they do. Those little dots that are in the middle of the top of each column are the confidence intervals. It's so small that, yeah, they're all strikingly better off in those states because they enacted an assault weapon ban. And because of who they are in terms of their willingness to do that and other things. They had the background, the social characteristics, personnel, to do things like this. So it's probably just not the ban. But this is new data. It shows that they all benefited from it. Illinois, being the last one, just did it in the last 2 or 3 years, so we don't have data from them because of 2022 being the last year. See, there's one more thing. I was skip this. This is under 15-year-olds for the same opposition of data. Under 15-year-olds. Now you see a much wider vertical bar, the black bar, because that's the confidence interval, and there are fewer subjects, so it's going to be wider. But even they show a very definite, statistically significant reduced death rate in their less than 15-year-olds associated with having a federal statewide ban. These are new data. Help me publish it. And that's the difference. 2/3 reduction in the states that have the ban. All right, I got to quit on that. I'm going to just go to questions and answers about that. And then we'll probably conclude here, and if we have time, something else. Okay, I was told at one of these meetings, maybe El Paso, McAllen, San Antonio, forget it, the ban will never work. All right, you want to talk about it? Yes, here, microphone coming.
Yeah, so my concern and the reason I still think the assault weapon ban passed in a state will not work is because I don't know how many millions of these things already exist in Texas, but they're not going anywhere. And the bad guys are going to figure out where they are if they want them, and they're going to take them. And so the reason I think your data are so striking is the states that passed statewide assault weapons ban also passed lots of other bills at the same time. And so it's not just a reflection of the assault weapons ban. And the practical part of getting an assault weapons ban passed nationally in my lifetime, I think it's extremely remote. So I think we should look at things that are more likely to happen.
Being more practical about that. I do know
that's
that
the last
it's not
question
just the
for-
weapon, it's the ability to take a pistol and with a very cheap attachment, make it an assault weapon. I've seen the videos. It's striking how easy it is to do. And of course, the 3D guns that you can build at home and are assault weapons. It's so easy to turn anything that shoots bullets, at least real bullets, not some of the play kids things, into an assault weapon that even the bans can't really effectively prevent that. The other problem is that, oh yeah, it's time for, I'm done.
I'm not showing this to your face. Time to wrap it up, Dad. All right.